Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by a grant from the Iowa Oncology Society. And my guest this evening is Pamela Mason. Pam, welcome.
Thank you.
We're going to be talking about the American Cancer Society and what the American Cancer Society does for patients. And Pam is in charge of patient services for the state of Iowa and maybe part of Minnesota and South Dakota and Nebraska, the upper Midwest.
Iowa and Nebraska.
Iowa and Nebraska. Well, welcome.
Thank you. I'm so happy and honored to be here.
Well, and before we talk about the American Cancer Society and specifically the patient services, let's get to know you a little bit.
Okay.
So where are you from originally? Where were you born?
So I was born and raised in Newport News, Virginia.
Oh, okay.
And so have you heard of Newport News,
Well,
Virginia?
I was in the Navy and spent some time over in the Virginia area.
Okay. Well, so Newport News is part of the Tidewater area or Hampton Roads. And so it includes cities like Newport News, Norfolk, Hampton, Suffolk, Chesapeake. And so basically it's on the southeastern portion of Virginia. And it is where the Chesapeake Bay opens up into or meets the Atlantic Ocean. And so it's known for its waterways and its beaches, but it has a strong history and huge military presence.
Yes, big Navy presence, but also other. And did you go to high school there?
I did.
Okay. How big of a high school?
Oh my goodness, I think we had 900 and some in our graduating class.
Oh my gosh.
Yes.
So it must be hard to distinguish yourself. But my favorite question for you is, what was your personal claim to fame in high school?
Oh my goodness. I don't know if I should admit this or not.
Well, you can say anything you want. We're not going to fact check. You can say valedictorian and homecoming queen?
It was neither one of
Okay,
those.
okay.
I studied hard, but I liked to socialize as well.
Okay.
And so I do remember my chemistry teacher one time pulled my boyfriend at the time and I out of the classroom and had said that if we put as much focus into her chemistry class as opposed to our chemistry, we would probably be doing better in her class.
Well, I think that's something to be proud of as a claim to fame. Yes, you had a lot of chemistry. And then what did you do when you graduated from high school?
So after high school, I went to Virginia Tech, and so along the science theme, I did get an undergraduate in biology.
Okay.
And then I went to graduate school also at Virginia Tech, and I got a master's in human nutrition and foods, but my work focused on the food science side.
And what was your first job after your master's degree?
My first job after my master's degree was in Atlanta, and it was working for working in research and development for a chicken restaurant called Church's Chicken. And so it was primarily down in the South, and so I worked in R&D, so I helped develop new products, but I also helped write like food safety and sanitation procedures, and I would like train our zone directors on the products and how to cook them properly. And
what new product did you work on that you're most proud of?
Oh my goodness. How about I'll answer it this way. So the legendary Hank Aaron was a Church's Chicken franchisee. And so we worked really hard on developing jalapeno chicken tenders.
Society have done various things over their American Cancer Society career. What are some of the roles that you have played for the American Cancer Society?
Okay. Well, when I first came to the American Cancer Society, I was hired to be a CPS 3, so a Cancer Prevention Study 3 project coordinator. And there's a little backstory to that. I actually worked at General Mills in Minneapolis for about 11 years or so. And I just, cancer has impacted my family as well. And when I worked at General Mills, it just seemed like more and more people around me were being diagnosed with cancer. So I actually started as a volunteer first, volunteered at the Relay for Life. And then I found out about a cancer prevention study 3 that I just mentioned, that was taking place at Relay for Life events across the country. And I got involved with their publicity committee. So when I was at General Mills, while I couldn't get General Mills to become like an enrollment site, I did have the opportunity to promote it in what we called Champions Corner. So that was a prized piece of real estate in the corporate office where no matter if you're coming or going, you're going to see this. So I helped, helped enroll people into the study and create awareness around that. So fast forward, when I started at the American Cancer Society, I'd been with General Mills 11 or 12 years. This position I took was a 1-year position. So it was a risk. But I found, I felt like volunteering was maybe like a calling. Growing up, I mentioned the military, the service, and my family was in the military, and they just taught me about the importance of service and giving back to others and contributing to life itself and beyond yourself, right? And so when that position, when it was almost up, I had the opportunity to apply for, back in the day, I think it was called like a hospital systems account manager. And so I got the position, and I was working with health systems, cancer center programs across greater Minnesota. And then there were a team of 5 of us. And then eventually the team of 5 became a team of 1, which was me. And so then I had all of Minnesota, and that was where I have spent most of my time, is working with cancer centers, health systems, and we, in our role, we support patients and caregivers along the entire cancer continuum. And so what we do is we want to make sure that patients and caregivers and health professionals are aware of the programs and resources that we have, so that they can talk to their patients and caregivers and try to refer them to these resources that we have. And as we all know, there's so much information, so much is changing so quickly. We also try to help the health professionals by providing them with evidence-based resources and opportunities so that they can continue their education and stay on top of things as well.
Yeah, and we're going to get into some of those programs because you're right, every Commission on Cancer certified cancer program. So the Commission on Cancer is from the American College of Surgeons, and ironically, American College of Surgeons is ACS and American Cancer Society is ACS, and they both were founded within a year of each other 110 years ago, and have been in lockstep ever since with the certification process for cancer centers. So every Commission on Cancer certified cancer center has someone from the American Cancer Society that serves as a liaison with the cancer committee. And Pam happens to serve as our liaison from the American Cancer Society to our cancer committee. And we just had a meeting on Monday that she was there. You mentioned the CPS 3. So one of the roles that the American Cancer Society plays is they actually, not only do they fund a lot of research, but they actually conduct research. And one of the most important pieces of research that they've done over the past 20 or 30 years is the CPS cancer prevention studies, and we're now part of CPS 3, and I happen to be enrolled in that
Me
study.
too.
So, in that study, well, maybe you explain what the study is. So, obviously, or maybe not so obviously, it enrolled people who don't have cancer in the study. And maybe talk about what the CPS 3 study is and how that research is conducted.
Sure. So it is a population-based study, and we recruited over 300,000 people across the country because we wanted to better understand one's personal health history, family health history, diet, exercise, exposure to like the sun, for example, and other environmental factors. We wanted to study a variety of factors over time.
So what we eat, how much we exercise,
Yes.
how much we drink, whether we
Smoke.
how much we weigh, how tall we are, all sorts of information gets collected each and every year.
That's right. You start with or the participants started with this foundational survey. It took about an hour and a half. And so to your point, every year they get another survey so that they can update things that have happened over time. Maybe, during that time you were diagnosed with cancer, or maybe your mom was. And some participants are invited to provide like a blood sample, for example. And that enables the scientists to kind of track what is happening. And if a person gets diagnosed, they have the ability to look deeper and try to understand what's going on here. Is it because of their diet or lack of activity, for example, or maybe it's because something genetically it had
or sleep habits or work environment.
Exactly. It's very comprehensive in terms of the types of questions they ask and what they're looking for. And so it's not only to understand additional ways to help prevent or reduce the risk of cancer, but it's also understanding when cancer does occur, trying to find out the whys behind it. And then how can we, based on what we're learning, optimize people who have gone through cancer when we think about just optimizing quality of life? How can we try to come up with recommendations that will make life a little better based on what we're learning?
It's studies like these that end up showing the link between, for example, cigarette smoking and cancer, or alcohol consumption and cancer,
That's
or
right.
obesity and cancer, or lack of physical activity and cancer. And one of the exciting things about CPS 3 is that everyone that enrolled had some blood taken from them at the time of enrollment. So if down the road 20 years, and that blood is stored, if down the road they develop cancer, we can go back, American Cancer Society, go back, look at that blood sample and say, was there something going on that might have helped predict that this person 10 years from now was going to detect a cancer? And now we actually have the ability, which we didn't have back when the blood was drawn, to actually detect circulating tumor DNA in a blood test.
Right.
So it'll be interesting to see if somebody developed cancer 5 years later, whether you actually might have found that circulating tumor DNA in their bloodstream, and all sorts of other interesting studies.
Absolutely.
So right now, you're no longer working with CPS 3, but you are definitely working with patient services. We're going to move the microphone a little closer here. So having worked with many different cancer organizations that are all wonderful, I would have to say there's no organization quite like the American Cancer Society in terms of boots on the ground and services they provide, not only to patients but to doctors. But let's focus a little bit on the services that are provided to patients by the American Cancer Society. And there are several different types of services the American Cancer Society provides free of charge to patients. Maybe let's go through those one at a time. What would you like to tell us about first?
Well, in addition to just information and education, we have some signature programs. And so one of
Well,
the
let's not skip over the information
Okay.
piece. That's huge.
that is huge.
Huge what the American Cancer Society does for patients and for physicians. I mean, every year the American Cancer Society comes out with cancer facts and figures, and it gives you every incidence of cancer diagnosed in the whole country over the year, how many people were diagnosed with every type of cancer, breaks it down by state. Also, how many deaths were there, breaks it down by state. And also talks about how many survivors there are in each and every state. So just one piece of information, but we got to give a shout out to cancer.org, right?
Absolutely. Absolutely.
And that's the website of the American Cancer Society with so much patient-focused information.
Absolutely. I bet regardless of the question you may have around cancer, whether it's, some of the key statistics, risk factors, what are some treatment options, what to expect with a particular treatment, you can either read about it, you can either watch like an animated video about it, you can get questions answered around, health insurance or, you name it.
And you can even call somebody 24/7.
Yes.
An actual human being.
An actual human being, yes.
24/7.
Yes.
Cancer
So
questions.
that is what we call our National Cancer Information Center. And we have trained cancer information specialists as well as like an oncology, a team, if you will, of oncology nurses. That, like Dr. Deming said, you can call 24 hours, 7 days a week, 365 days a year. And I can guarantee you they have probably heard every question that there is.
Okay, here's a question. What's the phone number?
What's the phone number? It is 1-800-227-2345.
And repeat that again.
1-800-227-2345.
There you go, 24/7.
Yes.
A questions answered about in general. They're not going to give specific medical advice.
That is correct.
But general questions are answered, and even opportunity to provide some probably resources that are available in the community the person happens to be calling from.
Absolutely. We partner with Find Help, for example, and so when someone calls into the NCIC, that cancer information specialists can look in our database to help that person if they are in need of particular resources, get access to it, and if it's something that we can't provide, access to other national resources, or
This
even
show
local,
might actually
or
be in the
even local.
database.
Exactly.
As a
Exactly.
a resource for people
Yep.
in this area.
Because they will ask, what your zip code is, and then we are able to dial down to the zip code to get that information.
Information is great. Pam brought some pieces of information, and this is a wonderful document. It's a Cancer Prevention and Early Detection, Facts and Figures 2026. Just one of the annual publications that comes out that slices and dices information, and it is used, this and the Cancer Facts and Figures is used by every authoritative institution throughout the world as the facts and figures for cancer.
That's correct. Our Cancer Facts and Figures publication is the most highly cited resource publication that there is out there.
So, cancer information, number one. What should we talk about next?
Okay. We can talk about our Road to Recovery program.
Let's do that.
If you like. Okay.
Yeah, Road to Recovery.
So, transportation is oftentimes a huge, huge barrier for patients. And we know that if they can't get to their cancer-related treatment appointment, they might not get the treatment that they need. And so Road to Recovery is a volunteer driver program where volunteers are thoroughly trained to be able to then give patients rides to their cancer-related treatment appointments. And so a volunteer and I'm saying this because right here in Polk County, we are in need of volunteer drivers. And so the volunteer drivers need to be between the ages of 18 and 84. They have to have auto insurance, have to pass a background check. They have to go through our training, and the training takes about an hour and a half. It's different modules that they go through. It's about ACS, it's about, safety with the patients and just safety in driving. And like safety and sanitation procedures. So for example, what happens if I'm taking someone to treatment and they get sick, for example? There's a section in there on communication because, like you mentioned earlier, whether it's like NCIC or whether it's our volunteers, they're not to provide medical advice, but sometimes, our volunteers are just a listening ear. Mm-hmm. Right, and just being that listener and just providing that sense of empathy and support, and so they go through that training as well, and then they learn how to pick up rides. So over the years, we have been able to invest in technology that has enabled us to optimize our volunteer driver and our patient experience. So we partner with a rideshare company. And so when a patient or a caregiver on behalf of their loved one, when they call into NCIC, because that's how they get the process started to get a ride, after someone from NCIC confirms that the patient is eligible for the program. So quickly speaking, they need to be in active cancer treatment. They need to be ambulatory, so they need to be able to walk on their own, or if they need assistance, they can have a caregiver come with them. If they need assistance via like a walker or wheelchair, we want to know that to make sure that the volunteer and their vehicle can accommodate that. And then they have to be free of like anesthesia, any sort of like radiotherapy, and they have to be free of just illness in general. And so when that patient or the caregiver calls into NCIC, in addition to finding out if the patient does qualify for the program, they ask if they are comfortable with technology. So if they are, then they get a link to our rideshare partner where they can go online through this app and they can schedule their rides. They can cancel their rides. And so on the other side, the volunteer also will get trained how to use this program. And so they can see what rides are in the queue. And if it works with their schedule, then they can choose that ride, and then they can text or call depending on the patient's preference, to let them know, hi, I'm Pam, I'm going to be picking you up and taking you to your appointment, and that's how it happens. Mm-hmm. So when the stars align, it's just a wonderful way to help people get to treatment. But it doesn't solve the problem. I mean, we have to rely on a variety of transportation resources, and our Road to Recovery program is just one of them.
Right, one of them. And it's amazing things happen, relationships that happen between patients and the individuals giving rides. I know that a lot of time the people that volunteer to give rides have been touched by cancer and maybe were at one time a cancer patient themselves and is now a cancer survivor, or they might be the surviving spouse of someone who had died of cancer, and in paying it forward is actually volunteering to give rides. So in terms of transportation, that's a big one, the Road to Recovery. If someone watching us today wants to volunteer to be a driver, how would they go? How would they initiate that process?
Okay. There are two things I would recommend. You can either call our 1-800 number, so 1-800-227-2345, or you could go to cancer.org/drive. And that should take you there to our site that would then enable you to get more information on how you can sign up.
So sticking with the transportation theme, that's one way in which the American Cancer Society helps reduce the barrier of transportation. I know another way of helping to reduce it is by helping those individuals who have the ability to drive themselves, but the price of gasoline can be an obstacle. So the American Cancer Society does provide some cancer centers with cards for gasoline that can be given to those patients in need of some financial assistance for gas because of the transportation.
Absolutely. So, yes, we offer transportation and lodging grants. It is a competitive process. We work with our cancer centers and our health system partners across the country, and they apply to be able to receive this funding. And when they apply, we want to understand, what does that need look like? Tell us about the disparities, tell us about the population, try to tell us about, how often are you hearing this as being a problem? And so it's really nice to be able to provide our health system staff with this funding. They use it at their discretion, meaning if based on their population, let's say some of the patients live by a bus line, for example, they can allocate some of their funds to gas cards, but they can also allocate some of those funds, for bus passes or taxi vouchers. In some areas where they are allowed to partner with like Lyft or Uber, they have the ability to purchase vouchers for that too. So it's really nice.
So that's the transportation piece. What patient service do you want to talk about next?
We could talk about our Hope Lodge program.
Let's do that.
Okay. So our Hope Lodge program is a home away from home. It really is. It's beautiful. It provides patients and caregivers free lodging so that when they have to, so when cancer treatment isn't close by, when they have to travel away for more specialized cancer treatment, the Hope Lodge allows patients and caregivers a free place to stay. And so it's a home. So just warm colors, just beautiful furniture. Each room has like a double bed and a twin bed and TVs.
But they're private rooms. You're not sharing a room with another patient.
Correct.
But they have multiple beds because you can bring a family member
Correct.
with you to stay with you
Correct.
in your room.
And what's really nice is that while every cancer journey is unique, right, and it's different, that said, you're in a community or you're with a community of people that do understand.
Right.
So it's also like a support network.
So it's not just a hotel room. You're actually in a lodge. You have your own room for sleeping, but then there's the common area
Right.
for activities and supportive services and meals. And every evening, a group might come in and provide a meal or other services. So it's a lot of camaraderie and support, not just a bed to sleep in at night.
Absolutely. Yeah. You mentioned the common areas. They have kitchen spaces so people can come in and store their food there, shelf-stable foods, refrigerated and frozen foods, and so they have the ability to cook there. But like you said, Cooking Up Hope is one of our signature programs that's a part of Hope Lodge, and it's wonderful for volunteers, whether they're from corporations. We have a lot of health system staff. Like we'll have departments like radiation oncology.
Come in and cook a meal that night.
They will, and so it's a wonderful opportunity for them to see firsthand the impact that the Society's Hope Lodge is having on their patients. Because again, sometimes that may be the only way that they can continue with their treatment.
How many Hope Lodges are there in the United States?
There are 31, and we have
one in Iowa.
One in Iowa City, and then we have one in Omaha. And I guess they're about the same distance from where we are here in Des Moines, about a couple hours.
So one of the great things about the Hope Lodges is, again, it's not just a bed to stay in, but it's really a place where there is supportive services and camaraderie. One of the disadvantages is there's only 31 in the whole country, and only one in Iowa, and so there's one at the University of Iowa. But the American Cancer Society understands that there's lodging needs elsewhere, so the American Cancer Society also supports other lodging programs.
Absolutely, absolutely.
And one is right here in Iowa, where the American Cancer Society supports the Above and Beyond Cancer Lodging Program. So Above and Beyond Cancer will provide free hotel stays for any individual in Iowa getting treatment in Iowa at a location more than 50 miles away from where they live. And the American Cancer Society helps financially support that program.
Yes, we do, because we know it takes a village, right? The American Cancer Society, we can't do it all on our own, and so the power of partnerships is really critically important, and so we are so, we're so honored that we can help support the Hotel Partners program there, because sometimes people want to get treatment close to home, and if they can, and we can support a program like the Hotel Partners program, it's just a beautiful thing that they can stay closer to home.
So there's two more programs that are relatively new compared to Ride to Recovery and the Cancer Information Service that I want to have you touch on. And one is Cancer 360, and the other is the screening program called I Love You, Get Screened.
Yes, that's how we have to say it.
So which you want to go talk about next?
Why don't we start with I Love You, Get Screened, and then I'll kind of segue into Cancer Risk 360.
Okay. I Love You, Get Screened, and this is one of the promotional pieces. So I Love You, Get Screened. So tell us, why is it called that?
It's called I Love You, Get Screened because it's about people. It's about human connections and just spreading the word and sharing with someone that you love, your friends, your family, your colleagues, that you want them to be around every single day. Every tomorrow should have you in it. And
cancer screening saves lives.
Cancer screening saves lives. So underneath the campaign, this is really built on emotion, and I love it. It's built on emotion and relationships as opposed to the statistics or the fear, right? But yes, the underlying premise underneath I Love You, Get Screened is for the very reason you said. Cancer screening saves lives. And the whole purpose of cancer screening is to be able to detect cancer before any signs or symptoms show. And so we do have, screening guidelines and recommendations for certain types of cancers.
And what are the nuts and bolts of the I Love You, Get Screened?
The nuts and bolts.
Besides just the campaign, are there ways in which you actualize inviting friends, family, loved ones to get screened?
Yeah. So I'd say it's really simple. We have these postcards, for example, where you can just, write a heartfelt message and just, mail it to someone you love. If you go to our website, we have a partnership with American Greetings. So for those who are like internet savvy and like sending and getting digital cards, we have digital cards that you can send someone around, I Love You, Get Screened. And, we like to be, like if you are, a part of a church group, or if you are just active in your community, and if it's like a health-focused event, we would love for you to just, start the conversation. You can use our collaterals, but start the conversation, because it's not only about getting screened, it's about educating around why it's important to get screened. And it's also behind the scenes. It's designed to address the barriers that people have to getting screened. So some people just may be scared, and that's normal, right? So they could be scared because they may get screened, or they may be scared to learn what their screening results are. So, they could be afraid of that. They could be afraid of how it may feel. Does it hurt? And so when we talk about information, everything I'm speaking to, you can find on cancer.org, or you can get this by talking to a cancer information specialist. But they could be fearful of, cancer isn't something we talk about. We in our culture, it's either taboo or it's something that we just don't talk about. And so it's encouraging the conversation, it's starting the conversation.
And it also provides, so you could, for example, happy birthday, you just turned 45. You're now eligible for colorectal cancer screening.
Absolutely.
So it gives that information as to, for average risk individuals, when does screening start, and then helps promote encouraging individuals they love to proceed with actually getting screened.
Absolutely. Because those barriers are really important. We want to help break down those barriers by providing the education. There could be the fear of cost. You may have insurance, but your deductibles are really high, or you may have a really high copay. And so, for example, on cancer.org, you can get information on, how do I go about maybe getting some assistance? Maybe, it's fear and cost because you don't have insurance.
Yeah, that's a big one. But one of the education pieces is, if you have insurance, because of the Affordable Care Act, your insurance cannot charge copays and deductibles for screening.
That's right.
So that's a good piece of information.
Yeah.
Let's transition to Cancer 360, because I know there's some parallels, because I actually went in and enrolled in Cancer 360, and there's the ability to, well, tell us, what is Cancer 360?
Well, first of all, that is wonderful, and I encourage everybody to take the risk assessment themselves. So Cancer Risk 360 is that. It's a risk assessment. It is a comprehensive risk assessment where people can fill out a number of questions. Takes about 5 to 7 minutes. You don't need to prepare for anything, but based on how you respond to these questions, it then gives you like a customized action plan on things you can do to help reduce your risk. It also gives you like your personalized action plan, and then it also provides you with questions that you can take your doctor, because the screening guidelines are evidence-based, but they're like population-based. So we're always going to say, your family history, your personal medical history, again, your diet, your exercise, tobacco exposure, exposure to even hepatitis B and C, for example. All these things can impact
your personal risk of developing cancer.
Exactly. And so I love it, because when we think about cancer incidence, there are 40% of cancers that are diagnosed are attributed to modifiable factors, and so this assessment looks at modifiable factors and non-modifiable factors. So what I mean by that is there are things we can't change. We can't change our age. We're getting older every single day. We can't change our sex at birth. We can't change our ACE. We can't change our race or our ethnicity.
And we can't change the genes we inherited from mom and dad.
That is correct.
And all of those are non-modifiable risk factors.
That's right.
But the modifiable risk factors are things we can change. And by taking this risk assessment, you'll get not only information about how you could personally lower your risk of cancer by modifying your lifestyle, but you also get information about which cancer screenings you are eligible for.
Absolutely. So, of course, depending on how you answer your questions, it's going to be personalized for you. So it's going to be different for all of us. And what I love about it is the action plan that you get. It may say, like, I have mine right here, and it's like, good for you for not eating a lot of processed meat. But it's like, in other areas, well, you could do a little more. Like, you're exercising a lot, but you could do a little more. But what I also thought was cool when we think about the environment, and here in Iowa, we think about our water quality, we think about pesticides, we think about radon. And that's exactly where I was going, because what I thought was really cool with what was in my assessment is in addition to the resources, right, on screening or whatever it is in your assessment that takes you to cancer.org to get more information, there are links to, for example, with respect to radon, a map. And so this assessment also asks for your zip code. And what I also love about the assessment is, in addition to the question you are being asked to answer, it also says, why are we asking this question? And so with respect to zip code, it's, why are we asking zip code? Well, it's because, have you heard that saying about like where you live shouldn't determine how long you live? So it's so we can dial down and really look at what does cancer look like in the state in this particular zip code. So I clicked on the link to this radon map, right? And it said that where I lived was in radon zone 1. And so I was like, okay, well, what does that mean? Is that good? And so there are 3 zones, and zone 1 is a high radon area, the highest.
Yes.
Right.
And Iowa falls in that.
Right.
Some other states, including part of Minnesota and South Dakota, but Iowa is, ground zero. So there, your risk assessment to-do list might include, have you tested your home for radon?
Absolutely.
Yes.
And it did. It asked me that question.
So if someone wants to, right now, while they're watching us, start the Cancer Risk 360, how would they do that?
They would go to cancer.org/cancer risk.
Okay. And cancer risk is one word there. So
yes.
cancer.org/cancer risk. And that'll take you to the Cancer Risk 360, where you can confidentially enter your information, and you'll get recommendations on how you might modify your lifestyle to reduce the risk of cancer, things that you might do related to environmental risks of cancer, like testing your home for radon, and you'll also get a list of the cancer screenings that you would be eligible for.
You mentioned something about just your information. You don't need to create an account. You don't need to provide like your birthday, for example. And so we don't.
You do have to provide the year you were born.
Or your age.
Okay. One of the two.
Yes.
Mathematically, if you know one, you can
figure
out the other. But yeah,
well, we don't store it. We don't store
yes,
it. And
no, good point.
So we look at everything in aggregate.
So not your exact birth date or
right.
Social Security or anything like that.
Because some people worry about that.
Yes, no, it's a good point.
So
I was just making the point that you can't give somebody the recommendations on, do you need to get screened this year if you don't know how old they are?
Absolutely.
Yeah, so,
yes.
But you just tell them how old you are.
Yes.
I'd forgotten about that.
Yes, yeah. And you can print your results, you can download your results, you can pass it on to someone you love and say, have you taken the Cancer Risk 360 assessment?
Does it give, I can't remember, does it give you the opportunity to email it to somebody else if you know their email address? Okay.
So I'm so glad that we had the opportunity to talk about these two programs, because this is really all about how can we take control of our health, right? And so this isn't just for people who haven't been diagnosed with, who haven't been diagnosed with cancer. We want people who've had cancer. We want like caregivers, for example, to take this assessment, because we know people who have had cancer, they have a risk of getting it again or getting a secondary cancer. And research shows that the caregivers of loved ones with cancer, they are often times either foregoing or delaying their own cancer screening, which is a part of overall health, right?
And as you talk about cancer survivors and their caregivers, I maybe loop it back to cancer information and let anyone know that cancer.org, so easy to remember, that there's information there not just for individuals who've been diagnosed with cancer, but for individuals going through cancer treatment, individuals who might be cancer-free and are survivors, but there's also a lot of information for caregivers, individuals who are walking the journey.
Absolutely.
And not to cut you off, but I want to save some time for questions.
Oh,
So
absolutely.
covered a lot. This has been, and we haven't covered everything, but we've covered cancer information, we've covered transportation needs, we've covered lodging needs and solutions, we've covered screening, and we've covered the Cancer Risk 360 assessment. So let's open up for questions. If you're watching us live streaming right now, you can put your question in the comments section of the software you're using, and we'll address Pam with those questions. But those in the room, our live studio audience, gets first questions. Gary, you're up first.
Yes, I'm interested, in the prevention part of that, and I know the modifiable type of risk that we can do. There's also one other thing is with the HPV that there is actually a vaccine that can help in preventing several types of cancers. Is that the only vaccine that is available, or is there some things that may be down the pipeline that we are looking at to try to help prevent cancers?
Do you want me to start and then you pick up?
Yes.
Okay.
Perfect.
So thank you for mentioning HPV, because not only with respect to screening history, even as a part of Cancer Risk 360, we are asking about vaccines, because to your point, how many times have we talked about, oh my gosh, we have a vaccine for cancer. And so yes, the HPV vaccine can help prevent like 90% of cervical cancers and other types of cancers as well. So like 6 cancers total. And so it is amazing to have a vaccine. And so that's why we partner with health systems so that we can ensure that we aren't missing opportunities for people to talk about the vaccine and why it's important to get their children vaccinated on time. But in terms of answering your question, I know from a research perspective that there's a lot going on in that space. I know we have some ACS-funded researchers that are working on like vaccines around breast cancer. I'm going to turn it over to Dr. Deming.
Good. And so just to amplify what Pam said, there are 6 cancers caused by HPV. One is oropharynx cancer, and 5 others are below the belt. But cervix cancer is one of those, along with vulva, vagina, penile, and anal cancers, all caused by HPV, and the HPV vaccination can prevent those 6 different types of cancer. There are other vaccinations that can help prevent cancer kind of indirectly. So, for example, hepatitis is the leading cause of liver cancer. So getting vaccinated for hepatitis can help prevent hepatitis within and of itself is valuable, but that can also reduce the risk of developing liver cancers. You will hear about cancer vaccines. I will say that cancer vaccines do not work the same way. The cancer vaccines are not to prevent you from getting cancer. It's a way of doing immunotherapy for someone who has cancer. So even though it's called a cancer vaccine, it's not like everybody would get this vaccine at age 20 to prevent cancers in the future. It's a way of stimulating an individual who has cancer, taking their cancer cell and making a vaccine that would give to them makes the antigen more available to the immune system to build up antibodies to kill their own cancer. So when you hear cancer vaccines, you shouldn't think this is a shot that everybody in the public gets to prevent cancer. It's a way of treating cancer. But it's the infectious disease vaccinations that actually can prevent cancer. So we don't give people an HPV vaccine specifically because HPV by itself causes disease that we need to prevent. It's because some strains of HPV lead to cancer, and that's the reason to do the HPV vaccine. Good question. Next question.
What do people do if we Can anybody volunteer to participate in the CPS study?
So,
And if so, how do we do that?
so enrollment has closed, and so for CPS 3 specifically, not at this time, but I'm sure we will have other studies where people can volunteer for in the future. We do have one currently going on right now, and it's called the Voices of Black Women study, and we are enrolling women. We're trying to enroll 100,000 Black women across the country because health equity underscores everything we do, and we know that that is a population that there are significant health disparities in that population.
I would bet in another decade or two, we might have CPS 4 as a new cohort is enrolled, but the number that were enrolled, did you say 300,000 enrolled?
For CPS 3.
CPS 3. And so it's actively collecting data on these individuals for decades. Yes. Next. I'm sorry.
Yes, sir. And I was going to say it was called CPS 3 because, it's CPS 2 was in the 80s. And so much has changed when we think about the environment, when we think about, traveling in terms of our commutes. A lot, our lifestyles have changed. And so, there's the recognition we need another cohort and study like the environment and every supplements and all
Sleep.
that. Right, exactly.
Yes.
We need another cohort.
Just a quick follow-up question. Given that the CPS studies are longitudinal studies, once once a new CPS study begins, do the previous studies continue to go on?
I would say they continue to go on, and we continue to analyze, study, assess what we continue to learn from that. Like with respect to CPS 2, that's where we learned about the association between sitting time and increased risk of certain cancers. So we're always like learning and pulling out new nuggets and kind of spreading the word. At CPS 2, we also learned about aspirin and reduced risk of colon cancer because of its anti-inflammatory properties.
Yes. Next question, George.
I, like a lot of people in the state of Iowa, we're concerned about these rising cancer rates by state, particularly here in Iowa. So has the risk assessment been revised along with the rising cancer rates in certain states like Iowa, so that if you live within this state, your assessment reflects that? And has the area, the zip code, for instance, how is it weighted? Is it taking on extra weight now because of these environmental challenges?
That's a good question. I'll answer it like two ways. I'll say, generally speaking, across the country, we continue to monitor the science. And so as we learn more, this Cancer Risk 360 assessment, for example, we will continue to enhance it based on the science that continues to come out or new technologies, for example. In terms of the zip code, like you mentioned, and like I kind of shared in my example, the zip code is key, right? And so we are asking for that because it enables us to dial down. And so fortunately in Iowa, we have like the Iowa Cancer Registry, the Iowa Cancer Consortium. I mean, I feel like the state of Iowa, we have a rich resources and an understanding of what is happening across our state.
I would agree, and I would say that Pam already gave an example of your zip code would influence whether the risk assessment tells you you should check your home for radon. So they're not going to tell everybody in the country that does this risk assessment that you need to go out and check your home for radon. But if you're in a zip code with a high level of radon, that would influence the recommendation. Just having filled it out, it's not going to tell you you have a 38.7% chance of developing cancer in the next 10 years based on your zip code. So it doesn't give you that sort of a percentage. It says based on your lifestyle, these are recommendations to reduce your risk of cancer. And then based on your age and your sex, these are cancer screening tests that you're eligible for today.
Yeah. Thank you for bringing that up. You mentioned the radon. Oh, I'm sorry. I just lost my train of thought, but it was a good point.
Thank you. That's a good point you just made, too.
Oh, shoot. Oh, the enhancements. Oh, my goodness.
Should we go to one more question?
Yes.
Well,
Sorry,
one
but
more-
I want to say
We're
it.
almost out of time,
when I
so we're going to
remember
go to one more question. But if you think of it as the question is being asked,
I will.
We will just time out and get you.
Okay, thank
Okay?
you.
Okay. One more question.
Do I have to press a button?
No, you just
All right.
speak.
I'm a retired guy with no ability to help somebody about information about cancer itself, but I can drive. And I have a clean driving record. I have time on my hands because I'm retired. And you talked about the driver program, the volunteer driver program. Could you provide information on that again so that I can go out and
Yes,
pursue it?
because you look like you're between 18 and 84. So I think
I fall right in
we
there.
need to get him signed up. How can he learn more about the road to recovery to become a volunteer driver?
Okay. I will help you with that. And so I can make sure that you get the website information or that you call NCIC, and we will make sure that you can start that process.
And somebody at
So
home
thank
right
you.
now, if they're at the computer, they should do cancer.org/drive.
Drive.
Oh, okay.
Cancer.org/drive, and that will get you the information on which individuals are eligible to be drivers and also the process of actually signing up.
I just remembered what I was going to say earlier.
Okay, would this be perfect timing?
So
We'll
you were-
close with this.
Okay, so Dr. Deming mentioned like the 87.5 or like how you aren't going to get a score. Well, we had heard that. We want people to give us feedback on the tool. And so we have, if you go to cancer.org, get screened, there's like an FAQ there, for example. And so we address that. And we say basically how this assessment is based on at a population level, and things that we talked about earlier can change your individual risk. So that's why we don't, give you a risk score per se.
There we go. Yes.
There we go.
Well, this has been wonderful. Our guest this evening has been Pamela Mason. Pam is Director of Patient Services for the American Cancer Society for both Iowa and Nebraska.
Yes, yes.
You probably
it's
have a different
technically
title.
I do, and that's
What's
okay.
your official title?
So, Associate Director of Cancer Center Partnerships.
There we go. And in addition for patient services, she also plays an important role at our cancer committee to be the liaison, making us all aware of these wonderful services so that we can make those services available to our patients. So thank
Yeah.
you, Pam, for being here.
Thank you.
If
It
anyone
was-
watching this knows somebody that would benefit by watching it again, you're in luck because this show will be available on demand beginning tomorrow at the Above and Beyond Cancer YouTube channel or the Mercy Cancer Center website. I hope you'll join us again next week. Thanks, everyone.
Okay. Thank you.